As you know, as of March 17th next year, Canada has legalized medical aid in dying. That's the term they use, but really what it is euthanasia. And we're here today to say no to assisted suicide, no to euthanasia. And it's going to be passed for those only with a mental disorder. There's over 300 mental illnesses, 20 classifications of mental disorders. We have a psychiatrist here today who will speak about that. I'm a family physician. My name is Dr. Paul Saba. And we as family physicians, we are the ones in over 50% of the cases, people come to us to treat mental disorders. We have a great shortage of psychiatrists, psychologists, social workers to help people. For people who want to see a psychiatrist, it's a 5-month waiting time. But in fact, with the law, they will allow people to be euthanized after 3 months. So when they get a phone call, it'll be too late. It'll be 2 months past the time that they've been euthanized. We need more care, and we do not need euthanasia or assisted suicide.
I think it's essential in our society that we put life first and foremost. I know that the Supreme Court has made a necessary part of liberty in the Carter case. I disagreed. I agreed with the case of Sue Rodriguez. However, I don't think it applies to psychiatric cases for 2 reasons. First of all, because Carter was based on the idea of full and complete consent. And I don't think that can be given. I would add that that would apply to pediatric cases as well. And I think also that the lack of imminence of death makes it something particularly dangerous, so that anybody could say, I don't want to live. I'm tired of it. My family is sick and tired of me. Would you get rid of me, please? And that's not, it's a wedge that could go that far.
In my practice as a psychotherapist, through the years, I have noticed that what people really need that are struggling with mental health issues, what they really need is a supportive, caring community where they feel valued, where they feel cared for, where they feel accepted. And even when that they feel prayed for, I have observed that if given the right tools and the support and the hope, that usually they recover and that they are able to go back into society.
So as an intervention worker who has worked in a women's shelter for more than 5 years, I've been exposed to a variety of different situations and the wide range of difficulties facing women today. I've also observed what isolation can do to further increase that vulnerability. For example, lack of social supports and resources, follow-ups with doctors and social service professionals, and so on. I have had discussions and intervened with women living these types of experience, some who have dealt with suicidal ideation and thoughts of self-harm. One woman who I've encountered dealt with intense trauma, abuse, and abandonment before arriving to Canada. The services that she received were limited due to her status. She made a suicide attempt on more than one occasion. Thoughts of suicide constantly bombarded her. The precarity and urgency of this woman's situation was named by health and social service workers. The alarm was sounded, and the need for stricter psychiatric follow-up was emphasized. But it took months and years of pleading and more than one suicide attempt for these supports to be unblocked. Why the lack of investment and funding in the supports and resources necessary to lift people out of these situations of despair? Many would advocate that for someone like her, living every day with mental anguish, she should have the right to end her distress.
My name is Christina Williams, and I'm a special education technician working with adults who have various special needs. So autism, cerebral palsy, Down syndrome, that sort. I'm also a professional dog trainer, and I merged these 2 professions by bringing zoo therapy or pet therapy to my workplace. So according to the CDC, so the Center for Disease Control and Prevention, Adults with disabilities are experiencing frequent mental distress almost 5 times as more as people without disabilities. So imagine that's a whole population that people forget about, because as soon as you have special needs, they put you into a box and they forget about the fact that you can also suffer from mental illness. Some of the areas that my students in particular struggle with revolve around difficulties in social skills. So how to create and maintain relationships, communication, isolation, self-esteem issues, emotional regulation, and just feeling like they want to fit in. So my dog, Arya, who's right here, something magical happens when I bring her into work with me every day. So when they come in and they see her at the door, a smile stretches across their face and it reaches their eyes. As she roams around during their leisure time, the students begin to crowd her and talk about her, and they don't realize it, but they're able to create social bonds because now they have something to talk about. Of course, pet therapy is not only for people who have special needs. To be honest, you don't even need to have a certified therapy dog to benefit. All you need sometimes is a pet at home or a friend who has a pet, and that itself does the job that it needs to get done. When we're going through our darkest struggles and it feels like there's no hope or no reprieve or no light at the end of the tunnel, we do not need a hand stretched out to lead us to our deaths and tell us to give up, that this is all there is. What we need are hands, and maybe sometimes even just paws, that will walk with us through that darkness.
Now, most psychiatrists, we work in hospitals in teams. So in our teams, we have social workers, psychologists, and nurses, and so on. And we try to keep it so that everybody's actually equal. In Canada, so far, there's 31,000 people who have been killed because they asked to be killed. And it's something like 6,000 medical suicides per year. So far, people with mental illness don't have the right to do that, but they will in March of next year. In 2020 in Belgium, 100 people were studied who asked to be killed for mental reasons alone. So about half of the people who asked to be killed for mental illness, half of them have severe depression, which is treatable, and half of them have conditions called personality disorders, meaning that they just have trouble getting along with people and getting things that they need from people. None of us want to kill anybody. None of us want to be asked to kill anybody. And none of us want to approve killing anybody. We want to treat people